welcome everyone. Welcome. Thank you all for your time this morning. If you did not get to register, please, by all means, do that so we can ensure that you get all the information that we're going to be sharing today, as well as we have a few drinks here and there will be refreshments later. At this time, what I'd like to do is bring up Reverend Teresa Walton O'Bannon, who will give you all our official welcome. Thank you.
Good morning. Oh, come on, good morning.
Good morning.
Everybody's still asleep, right? Everybody's still asleep. Just wanted to take this opportunity on behalf of Emmaus Ministries, Faith CDC, and Wayside. We want to thank them, for having us here to welcome you to the heart of the matter, a discussion on HIV/AIDS in this community in recognition of National Black HIV/AIDS Awareness Day. And so what we're here to do is to get educated, right? We're going to get educated. Want to say amen. That's the preacher name. Amen. Want to get educated, get tested, get involved, and if we are positive, to get treated. That's very important. So we just want to get started. I'm not going to belabor, so we can go on and get with this wonderful panelists. I want to thank each and every one of you for taking time out of your Saturday to come and to share with us. So we're just going to go ahead. I'm going to bring Tony Phelps up, and she's going to do our introductions, and we're going to get started, all right? Thank you all again for coming.
Good morning, everyone. So glad to see your wonderful, beautiful faces this morning for this conversation, and we are really excited to have all of you here, and especially to have our panel of experts and panel of people who really know what's happening with HIV and AIDS, not only around the country, but here in our community. So, excuse me, just wanted to take a few minutes to allow them, if they don't mind, to introduce themselves, give us your name, the organization that you're representing, and just a little bit about your involvement with what we're discussing today and what you're bringing to our discussion. So we'll start with John.
My name is John Garner, and I'm with AIDS Interfaith Ministries of Kentuckiana. We are the longest running HIV/AIDS service in Louisville, Kentuckiana area. It was founded in 1989, and we do emergency housing assistance for the homeless, non-HIV medical costs, including prescription drugs and medical equipment. We assist with eye care, nutritional food bank assistance, household supplies, fitness programs. We also have a monthly community dinner at the Central Presbyterian Church on Kentucky Street. We have an annual spiritual retreat. We assist with transportation to appointments and things such as that. We also have support groups and educational and vocational workshops.
Good morning, my name is Larry Clark. I'm from the Unity Group of the Vision of Emmaus Ministries. And basically what I do is house clients that has substance abuse problems, drugs, alcohol, what have you. And recently, as myself, we realized that it's more than substance abuse. It's HIV, it's AIDS, it's hepatitis C, and other chronic illnesses, including sexual identity, mental health. So I just decided to do the wraparound. If you only treat the alcohol and the drug piece, then we do other issues out. So we treat that as well. And not only housing, but we do have tremendous community resources that we use, and people that are available to come as professionals. As
Good morning. My name is Elwood Stroder. I'm with the University of Louisville 550 Clinic. We administer the Ryan White Part B, C, and D grant. So So we provide psychosocial services and Part B, part of the grant to our clients, and we also do the medical part with the C and D part.
Good morning, everyone. My name is Shanette Owens, and I'm the program manager of Volunteers of America STOP team. And what we do is prevention. We do outreach and testing. We have prevention case managers where they actually work with positive individuals to reduce the rate of infection. I'm part of the prevention piece with the state. And what we're charged to do is to get those hard to reach populations such as MSM population, or males that have sex with males, high risk heterosexual, IDU, drug usage, and I'm in agreement that you can't just deal with those issues without dealing with all the psychosocial factors that cause them to put themselves at risk.
My name is Jelani Kerr. I'm an assistant professor at the University of Louisville. I'm at the School of Public Health and Information Sciences. I do research on HIV prevention, developing HIV prevention programs, and I do research on treatment, particularly how often people are going to the doctor, what happens if you don't go to the doctor. Look at a lot of things. Right?
All right, well, we want to thank our panelists for being here. So I know this is going to be a very good discussion, a lot of knowledge and expertise sitting here at this table. But I also want to just let you know that we have some other groups that are joining us today. You'll see around the edge of the room there's some tables. And these organizations have come to provide information about the services that they provide. I'm going to start in the back here. It's Kate Davidson. She's with House of Root. Again, Reverend Teresa Walton O'Bannon and Art O'Bannon, Emmaus Ministries. I'm with Bates Community Development Corporation. I'll be at the table with the purple overlay, so if you want to come talk to me about what we do. We also have a young lady here from Walgreens. I apologize, I didn't get your name.
Okay, my name is Faith.
Faith, thank you for being here. Again, John Garner, who is here with AIDS Interfaith Ministries. So after our discussion, he'll be at his table. And then we have some of the team from Volunteers of America, the STOP program. So just make sure you go around to the table, see what they have to offer. Talk to them. Great.
All right, can we give everyone a round of applause for being here? Been charged with the awesome task of asking the questions to you guys, okay? All right, so I will be passing the mic, but I want to focus really on the area of expertise that you all have and really getting the facts out here, because we often find that when you know better, you can do better, and it often seems that people just don't know better. So today we want to make sure they get the information from the experts, okay? All right, first question. What is HIV and AIDS? And I will pass the mic down to the gentleman on the end. Let's start with you, sir.
All right, so HIV stands for human immunodeficiency virus. So this is essentially a virus that attacks the body's defense system. It attacks the immune system of the body. What happens is that it damages the immune system to the point where other sicknesses and other germs and other diseases that your body would normally be able to fight off, the body becomes more susceptible to it. And so there's not a cure for it yet, but there is treatment, and that's what HIV is.
Simply put, your whole entire immune system is stripped away to a certain extent, leaving you vulnerable to other diseases and things that are already out there. Okay, thank you. AIDS, is there a difference? HIV and AIDS, is there a difference? All right, thank you.
It was one question, but I'm sorry, it's a double up there.
No, that's okay, that's okay. So HIV is the actual virus. AIDS stands for acquired immune deficiency syndrome, which is a disease that's caused by HIV. Right? It's a syndrome that's caused by HIV. Okay. So there are, in order for someone to have an AIDS diagnosis, there have to be a few things that occur. One, you have to have been diagnosed with having HIV. You have to have been tested, and the doctor has to say that you have HIV. Secondly, you can get a list of. Secondly, there are a few diseases that people get. That where if someone says, "Hey, you have HIV, you have this HIV virus, and you have this disease," then we'll say you have an AIDS diagnosis. Or if you have HIV and you have a CD4 count, and CD4 is just it's a cell in your body that helps fight diseases. If they look at your blood and they see that you don't have enough of these cells, then they'll say that you have AIDS.
Okay. If you don't have enough CD4 cells to really fight off the actual disease, they'll say you already have the AIDS or the AIDS disease. Okay, all right. Now I'm just summing things up. As you all can see, I'm not the expert, but I do want to get as much information from the expert so we all know better so we can do better. All right. So next person I would like to ask a question of would be Shanette Owens. I've had the pleasure of working with her on other events and knowing that she is a wealth of information. The question I would like to pose to you today is, how many people are living with HIV and AIDS today? And I know those numbers can be staggering for the U.S. altogether, but if we can kind of pull that in and say, well, do you know the numbers here locally? Well, what is affecting us today in our area?
So kind of looking at the data, one of the things the STOP team is always charged, we're always charged in the field to know what that data is. Jefferson County, if you weren't aware, holds the largest disease burden. So Elwood's team actually case manages, thank you Christine, actually case manages around 1,300 to 1,400 individuals in Jefferson County that live here with that disease. So that's about how many folks that are positive in our community, but there's an estimated 4,000 or 5,000 who are simply unaware of their status that exist right here in Kentucky. And so those numbers can be staggering. And also what is interesting is looking at zip codes 402, 10, 11, and 12 are the highest rates of infection in the state. Can I say it again? In the state.
Say it in the mic.
In the state.
All right.
Not just in Metro Louisville, but in the state, we hold the heaviest disease burden. And if you look at those zip codes 402, 10, and 11, and 12, you notice that a lot of those are residentials, right? So that's where people live. But that's not necessarily where they play. You say, what do you mean by play? Where they hold certain activities. They may go to the bar. They may go to a bathhouse. Yes, we have one. It's called, they call it a men's spa. So it's kind of those kinds of things. So when you talk about numbers in Jefferson County, they're kind of staggering here. And the fact of the matter is the disease has been in existence to our knowledge for 30 years, and we have never, ever seen a decrease in Jefferson County. And so thus, we need to start talking about it, right? Right.
Well, one of the things I want to toss back to you, Shanette Owens, really is who is the most people, I guess the demographic that's really affected by this currently? Because I know you've given stats at other events and it was staggering to a lot of people. If you don't mind sharing that information, I would greatly appreciate it.
So kind of the population that it heavily affects is actually women. Yes. In particular, African American women. It actually impacts. And so a lot of questions I'm asked is why? Well, there's a number of reasons. There's a number of reasons, from one, not knowing your status, to number two, it's a bit of a cultural piece. So I can talk about us as a little bit. We don't necessarily always like to go to the doctor to get treated. We don't necessarily like to do those things. We have some fear about HIV. It's this big bad demon, and so there's a lot of stigma. There's a lot of even discrimination attached to that disease, and so therefore a lot of women in particular don't get tested. And sometimes we get focused on, well, how did they get it? Was it through sex? Was it through drug use? And those things are important to a degree, but the most important thing to focus on is that there are staggering numbers out there, especially nationally. Check this, we African American people are only 12% of the general population. When it comes to HIV, we are 44% of the population, with well over that being half women. Over half of those, of the 44% that is African American people, are well over half are women. So we have to sort of ask ourselves, move away from the why to the action part. What are we going to do about it?
I mean, was that not some powerful information, everyone? I mean, if you didn't know that today, now you know. 40210, you said, 40211, and 40212. That's right around us. I mean, if you didn't know, now we know. All right, at this time, I'd like to pass the mic and ask a question that you may be able to share with us, sir. Mr. Stroder? Okay, great. Regarding what your organization does to help people that actually already have the disease, and then what do they do if they're exposed?
Sure. Actually, our clinic is the medical clinic, 550 clinic for HIV and AIDS in the city. If someone is diagnosed, when they're diagnosed, they can come to our program if they meet our eligibility requirements. We do manage the Ryan White Part B, Part C, and Part D. Part B is the psychosocial part, the Part C and D is the medical part. The 550 clinic actually does the C and D part. We are folded into the 550 clinic, so we do the psychosocial part. So if someone is diagnosed, they can come to us. Our mission is to get them into medical care, keep them in medical care, and get them no-cost medicine. I know that a lot of times that's a big issue. Medicine is very expensive. HIV meds are very, very expensive. And one of our charges is to make sure that people have access to that medication. Because we found that if people get into medical care, stay in medical care, keep their doctor's appointments, take their medicine, their life expectancy is only 4 years lower than a normal person. If somebody who smokes, their life expectancy is 10 or 12 years lower than a normal person. So if we can get people into treatment, then we can actually give them very good quality of life if they stay in treatment. And that's what we really do. We also, if you meet our eligibility requirements, which you have to live in one of the 7 counties that we service, the state is divided into different regions. We're the Louisville region. We actually have Bullitt, Henry, Jefferson, Oldham, Spencer, Shelby, and Trimble County. Those are our 7 counties. So anybody who is in those counties actually comes to us for services. If they actually, once they come into our services, they have to actually be at 400% of the poverty level to be eligible. That doesn't sound like, you think, wow, that might be a lot, but actually a single person can make almost $46,000 and still be in our program. Of course, the status is they have to be HIV positive, of course, to be in our program. Our money, the Part B, C, and D money is only for people who are positive. So, and the services that are there. We also, we pay people's insurance premiums who are eligible for our program. So if you have gone through the Affordable Care Act, or if you have private insurance, we actually can pay that insurance premium for you. So that comes out of a program that's called KDAC, which we also help the state administer. We can actually help pay for that premium for you up to $800 a month, which is a big deal. I mean, that can really be helpful. And then to actually get their medication from us, it's mailed to their house, or they can have it mailed to the clinic, or they can pick it up if there are some issues involved with them not wanting anybody to know that they're getting their medication. But those are the services that are available from our clinic and our Part B grant.
Thank you so much. I mean, knowing, first of all, that if in fact you know someone that actually has this disease, and they just don't know what to do, there are resources out there for them, even taking care of their premiums and things of that nature. The resources are here. The next question, or the next person I would like to bring to the mic, is a gentleman that I've heard his testimony on several occasions, and a lot of times people think when you're diagnosed that that's the end, it's over. And people who do not have it assume the worst for someone else. So at this time I would like to have Larry Clark to share exactly how long he has lived with this disease. When did he find out he was diagnosed? And then just to understand what type of lifestyle do you have to live, just piggybacking off of what was just shared earlier, living a healthy lifestyle and things of that nature. What exactly are you needing to do to ensure that you're living the best life with this disease?
Thank you for calling me beautiful. Good morning. I'm just want to say, man, I'm truly blessed to be standing. I would like to tell y'all guys that, you know, as a kid, I had a normal life, man, but as a kid, my parents was alcoholic, dysfunctional family, and the alcohol made them blind to me being sodomized, molested, and further on as I got older, the rape process began. And just briefly, the guy was a friend of the family, and he was in the Army, which means he was in career a lot, transporting heroin back into the States. And they was using IV, shooting up. And as he was doing the 3 processes, sodomizing, molestation, and then the actual rape piece, he was HIV positive as well. I got tested in 1981, and they're still doing some backtracks because of the process. I mean, I was young when he was doing this to me. It was no medicines. I think it was just like AZT, and HIV and AIDS was not even circulating. It was a process called ARC, A-R-C, AIDS-related complex. People was dropping, they was dying. Didn't nobody know what they was dying from. And I guess as the process began, then they figured out it was like an immune deficiency syndrome. So HIV was born, and then the actual process of AIDS. I'm glad to say that I've never been hospitalized, never been sick. T-cell count is off the chart. Them are the healthy cells. The normal in a person that's not positive is 900 to 12, I think. I'm at 7, it's a change. Undetectable, which means they can't detect the virus in the blood. And it's not a cure, trust me. And just like my case manager said, man, you know, my meds runs a little bit over $2,000 a month for 3 pills. And I partner sister with Africa online, and they don't have what we have, man. So you know, just to say that, to say this, man, you know, it took me a while. It took somebody to die for me to tell my story. And it was my brother. I was teaching, doing seminars, but I would never speak. I'm on Facebook, you know, sharing. And the best thing that ever happened to me, man, is when I stood up and spoke out. And it relieves a lot of stress. It helps me to talk about it, man. And as far as you can see, I'm standing, I'm gorgeous, man.
Okay, getting back to the question. How long exactly have you had the actual virus, or do you know? Because you said you got tested way back when in 81, but could it have been possible that you had it before 81? Okay. So how long is that? I know you're not going to share your overall age, but if we can just get an estimate of how long you have been living with this. I mean, clearly that's a testimony to to a lot of people just to know that it, it can be done. How many years?
Well, I'm not good at math, so whatever 81 is from 2015.
Okay.
How many years? 34 years? Wow. Okay. Now, they're still backtracking because, as I said, this guy was doing some damaging things to me. It started when I was 5 and it ended when I was 17 or 18. So, wow. There's a big window there. So they're still doing some other things, man. So it works.
We thank you for your we thank you for your testimony. Considering the fact $2,000 a month for 3 pills, people, that's just outrageous. I don't know what's happened to the mic, but I do know I can speak loudly, so we're gonna go there, okay? All right. And at this time, what I'd like to do is ask you the questions, sir. I know you've been patiently waiting, but I would like to know exactly and share with people, how does it spread? That's the bigger deal. A lot of people are, unaware exactly what's going on and how do they contract it, how do who got it, why do they get it, and they're assuming a lot of things as well, which can be detrimental when you start assuming things. Really, you can leave yourself vulnerable. So if you can just share with us exactly how does it really spread? Thank you so much.
I'm not a medical doctor, so that is important to take in mind, but the information that I think most of us even know would be, a lot of it is fear and stigma that do keep it spreading, that keeps it spreading. Yeah. That open, honest discussion that you have to have with the people that you love, or your partner, the potential partner, to have respect for each other. A lot of times we're afraid to give that information out because of the stigma that can come back on us. They may not love you back because of that. They may not want to continue the relationship they have with you. So instead of being honest and open, you either don't tell them or you lie, or however that goes. Obviously, there are different ways to spread it. You can sexually transmit it, which there are different ways to do that. And I don't want to speak too far into that because it's probably better for a doctor to go into, but there is also transmission through needle usage, which is why there is a program that is being developed to try to figure that portion of the problem out, as far as needle sharing and things like that, trying to get access for people that are addicted to drugs to have clean needles and things like that if the process must continue. But, there are different ways that you can get that. I think that the reason that it continues to spread is because people just don't talk about it. And that's the important part, is to be honest and open and to love the person that you are with, and to love yourself enough to be able to be honest about it and to take care of other people in the community. Obviously there has to be some kind of blood or bodily fluid involved, but that, I think is honestly the easier part of that issue to handle. I think the main part is just the stigma of it and being honest with people and telling them what's up. And there's a lot of ways to protect yourself and others these days to keep them from getting it. As the gentleman just said, being undetectable is a big way to be able to deal with that. It is quite hard to pass that along if you are undetectable. You should always still use safe practices and things such as that. But that kind of information is important to know.
Thank you so much. One of the things I'm going to highlight really quickly, I was going to do it a little bit later, but this is huge for us to know that all the great information they've shared thus far, and they have more to share. If you don't know currently what your status is, it can be simply done through a simple test. If you don't mind sharing exactly how that testing process works, and to let you all know, we have that available for you all today just by being here at this event.
Okay, so first of all, we'll talk about the testing session itself, because people get a little bit nervous about that. Number one, there is no blood. I didn't get trained to do blood, so I don't do blood. So I don't expect my team to do blood. It is actually a simple swab. It takes about 20 minutes. And during that 20 minutes, you're not watching the thing turn. My team is actually talking to you, giving you some good education about HIV. Also talking about a little bit about what your risky activity. Yes, we talk about sex. Yes, we talk about that. And so they have those conversations with you. It is anonymous, meaning your name is not associated with a number. It is confidential in that my team doesn't tell me unless I have to know anything about your session. So that session is for you and that person to have an open, honest conversation. I encourage honesty because you might be able to get some information from them that you hadn't thought of. A little bit more of an incentive is that we are having a drawing. You get a double chance. If you go get tested, you get a double chance at having a chance at the drawing. So they'll give you a ticket and said, hey, I'll take it down to the bowl and they'll put it in there for a double, just as an incentive. But one of the things we also talk about is for your own personal health.
All right, thank you so much, Ms. Owens. And some of you all now have perked up to find out what is the drawing. Well, what is the gift? Well, we are blessed to have gift cards, $25 gift cards. All right, go ahead and clap for that. Somebody was about to clap, all right. What she's referring to is that you got a ticket, I believe, as you registered, and then you should get another ticket, as she stated earlier as well, if you go ahead and take the time to just go upstairs and get tested. It's anonymous. We wouldn't even know clearly, except we just want to make sure that we give everybody the chance to win these $25 gift cards. I'm not sure where they look to.
No, there's 10 altogether.
Okay, where are they to? Walmart gift cards. That's what I was trying to get at. Walmart gift cards. No, Walmart gift cards. At this time, we'll do one of those now. And testing is upstairs on the second floor in the Broadway room. Broadway room. All right. Shake it up, shake it up, shake it. All right. Okay. All right. 515. 2154. Oh wow! All right, come on up, man. Congratulations.
What's your name? Billy Joe.
Billy Joe.
There you go. All right, thank you so much.
And we will have door prizes like this throughout the. Oh, we're gonna do one more. All right, do one more. Shake it on up. All right, 515-2148.
Oh, before I come up there, we want to make sure that.
So make sure the ticket's correct. What is it?
2148.
Correct. It is. Okay.
Well,
Wonderful.
Aaron Wells. Aaron Wells.
All right, we'll be giving out door prizes throughout the session, and there will be refreshments coming in as well. Hopefully you all had a chance to go ahead and drink a little water. If you need a refill, we'll have those come up to you. But we have more questions to find out. So if you do want to step out, take a little break, please do so. We'll do 5 minutes till showtime. 5 minutes to the next showtime.